Cesarean delivery, C-section, is used to deliver a baby through surgical incisions made in the abdomen and uterus. Planning for a C-section might be necessary if there are certain pregnancy complications. Women who have had a C-section might have another C-section. Often, however, the need for a first-time C-section isn't clear until after labor starts. If you're pregnant, knowing what to expect during and after a C-section can help you prepare. Healthcare providers might recommend a C-section if labor that isn't progressing. Labor dystocia is one of the most common reasons for a C-section. A C-section is the safest way to deliver babies whose feet or buttocks enter the birth canal first, breech, or babies whose sides or shoulders come first, transverse. A C-section might be needed. A C-section might be recommended for women with certain health issues, such as a heart or brain condition. Like other types of major surgery, C-sections carry risks. Risks to babies include breathing problems. Babies born by scheduled C-section are more likely to develop a breathing issue that causes them to breathe too fast for a few days after birth, transient tachypnea. Surgical injury. Although rare, accidental nicks to the baby's skin can occur during surgery. Risks to mothers include after a C-section, there might be a risk of developing an infection of the lining of the uterus, endometritis, in the urinary tract or at the site of the incision. A C-section might cause heavy bleeding during and after delivery. A C-section might increase the risk of developing a blood clot inside a deep vein, especially in the legs or pelvis, deep vein thrombosis. Although rare, surgical injuries to the bladder or bowel can occur during a C-section. A healthcare provider might also recommend certain blood tests before a C-section. The test results can be helpful in case you need a blood transfusion during the C-section. Discuss the possibility of a C-section with your healthcare provider well before your due date. A permanent birth control procedure might be performed at the time of the C-section. A C-section can be done in various ways, but most C-sections involve these steps. Your healthcare provider might ask you to shower at home with an antiseptic soap the night before and the morning of your C-section. Don't shave your pubic hair within 24 hours of your C-section. This can increase the risk of a surgical site infection. Your abdomen will be cleansed. A doctor makes surgical incisions in the abdomen and the uterus to deliver the baby. The doctor makes an incision in the abdominal wall. The uterine incision is then made usually horizontally across the lower part of the uterus, low transverse incision. Other types of uterine incisions might be used depending on the baby's position within the uterus and whether there are complications, such as placenta previa or preterm delivery. The doctor clears the baby's mouth and nose of fluids, then clamps and cuts the umbilical cord. A C-section usually requires a hospital stay for 2 to 3 days. Your healthcare provider will discuss pain relief options with you. Once the anesthesia begins to wear off, you'll be encouraged to drink fluids and walk. This helps prevent constipation and deep vein thrombosis. Your healthcare team will monitor your incision for signs of infection. The bladder catheter will likely be removed as soon as possible. You can start breastfeeding as soon as you're ready, even in the delivery room. Ask your nurse or a lactation consultant to teach you how to position yourself and support your baby so that you're comfortable. Your healthcare team will select medications for your post-surgical pain with breastfeeding in mind. During the C-section recovery process, discomfort and fatigue are common. To promote healing, use recommended pain relief. To soothe incision soreness, your healthcare provider might recommend a heating pad and pain medications that are safe for breastfeeding women and their babies. To prevent infection, wait at least 6 weeks to have sex and don't put anything in your vagina after your C-section. Check your C-section incision for signs of infection. Explore Mayo Clinic studies of tests and procedures to help prevent, detect, treat, or manage conditions. Thank you for watching this video. Hit the subscribe button so you can get new videos. You can read more about this on our website www.wellnessbuddy.com.